So today we're going to start another important topic, which is fractional keratosis. Basically, let's start it with Rahim. So basically, the keratosis that occur is due to it is basically due to any mechanical trauma. Either it is a very sharp tooth or ill-fitting denture that continuously irritate the mucosa. That why the keratosis occur in that area basically. So basically, it is a white plaque, a rough ferrite surface that is closely related to the identifiable source of mechanical irritation. Means you can identify that this is because of this. Okay. Now it can be resolved when the irritant is removed. As we know, the removal of the offending agent, the lesion is resolved. But if the lesion does not heal within 2 weeks, then you have to do the biopsy to rule out whether there is any dysplastic changes is present or not in that area. This is a fractional keratosis. Okay. Precancerous lesion, these are very important terminologies you should know. Because it can be asked in your high competitive exams. So don't take it like these are small definitions, you should know it also. So basically, what is it? Is a benign morphologically altered tissue that has a than the normal risk greater than the normal risk of malignant transformation. Okay. Then you have precancerous condition, a disease or a patient habit that does not necessarily alter the clinical appearance of the local tissue, but it is associated with a greater than the normal risk of development, greater risk of precancerous condition or cancer development in that tissue. Means if you tell the patient to stop the smoking, but that lesion does not heal within 2 weeks, the clinical appearance of their tissue does not heal, it means it has a very greater risk of the in that tissue to become a cancer in that area. Okay. Pre-malignant potential is there, the risk of cancer being present in a precancerous lesion or condition either at initial when you initially diagnosed or in the future. Okay. Now very relative risk, basically you should know it is an epidemiological measure. You have studied in your community medicine that there is a relative risk and other type of risk. Means so it is basically a specific epidemiologic measure through which what you do, you basically there is an association between the exposure to a particular factor and then the risk of acquiring a disease. Means like a smoking is related to the lung cancer. Okay. This is expressed in a ratio of incidence or prevalence of a disease. Means it tells you that there is old and new cases, and the new cases of the disease among those are exposed or not exposed to the factor basically. So it is very important you should know a specific epidemiological measure that associates association between exposure of a particular factor and the risk of acquiring a disease. It tells you the ratio of the incidence and prevalence of disease among those who are exposed and who are not exposed. If you have tell you that in your exam someone asked me what are the precancerous lesions, you should know it is leukoplegia, erythroleukoplakia, basically speckled leukoplekia and candida leukoplekia. So always remember the highest, basically if someone asks you which leukoplekia has a high risk of development in the cancer it is always speckled leukoplekia or erythroleukoplakia. Okay. Precancerous condition someone asks you, so it is basically oral submucous fibrosis, lichen planus. You have also panic dysphagia also. Then you have discoid lupus erythematosus, trachycephalus, xeroderma pigmentosoma is also, and epidermolysis bullosa and xeroderma pigmentosum. Okay, so thank you.